Chai, ụfọdụ ndị boy na-afụsi anya. My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, T0rture, the Lupus Day. My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, T0rture, the Lupus Day. Last week I had 4 different patients. Their average age was between 15 to 21 years old. And they are all boys, and they are serving, as they are working for different businessmen, different masters, different businessmen. So the injuries they had ranged from ruptured tympanic membrane, dislocated jaw, excessive marks from flogging, and then of course I was also treating 3 of them malaria. So each time I asked, of course they were brought by different people, so each time I asked any of the guardians what led to maybe the rupture of the injury to the ear, they would tell me he's stubborn. I'll ask the other one, they will say he's stubborn. So now I was not like, because there is, in this aside, there's a way they explain stubbornness. And so I was not like, I want you to break down what kind of stubbornness that will lead to this kind of injury. That is, how stubborn will a boy of 16 years be that will lead to your slapping him continuously till you perforate his tympanic membrane? And they were not like, sometimes you'll be talking to them, they won't be responding. If he can, almost for about 1 minute, or you finish telling him something, he will say, please repeat. Or you finish talking to him, he will say, I don't understand. Or you will send him to do something, he will forget what you sent him to do something to do. So from the pattern of the response the caregivers were giving me, I discovered there was something peculiar about these people's illness. Now let me just briefly tell you about Apprentice, the apprenticeship down here in the Southeast. Apprenticeship is just like a way, it became very common after the war, when most of Igbos were treated as second class, in fact as 20th class citizens in their own country, because they were taken as people, even though Gowon declared no victory, no vanquish, but it was just on paper. The Igbos were taken as people who are defeated. So there was no more civil service, there was no money, there was all the universities in the Southeast were bombed and destroyed, and no new ones were coming up. So the rich Igbo men who were in businesses now started taking up younger guys. So they would train them in that their business, and after training them for maybe at most 5 to 6 years, 5 to 7 years, they will now do what is called iduhuno. They will now set up a similar business for them, give them some money to start their own. Those people that they set up will now pick up younger ones. When they stabilize, they'll pick up younger ones. So that is what we call apprenticeship. And all these boys are listed for you now as my patients. We are all apprentices of the men that brought them. So now the advantages of that apprenticeship is that it was able to create so many billionaires within a short while, because it helped raise families from 0 level of poverty to 1,000 level of wealth. In fact, it was what helped Igbos stand back firm now. The disadvantages is you might fall into the hands of a fraudster, or a wicked person, or a good man married to a Jezebel, or a good man married to a feminist who believes that no. So if your master has such a toxic family, or your master is a wicked person, or your master is a fraudster, you will make all those your 5 years a waste or he might accuse you falsely of one thing or the other, or he might beat you so much that you start having this kind of injuries that my patients were having. So now let me now come down to what really was happening to these people. What was happening to these people is what we call seizure. What is seizure? Seizure is a sudden, uncontrolled burst of electrical activity in the brain. Sudden, uncontrolled burst of electrical activity in the brain. That is what seizure is. Now, for you to understand seizure very well, I will divide it into epilepsy and non-epileptic. Epileptic seizure is a seizure that has occurred more than once and doesn't have a trigger. Epileptic seizures are divided into idiopathic and symptomatic. Idiopathic has no cause; it just happens. Even if you keep tracing to find what is the cause, there will be no cause, no familiar cause, no disease, no nothing. While symptomatic normally presents with a cause, and is normally common in neonates and elderly. Those symptomatic can be as a result of trauma to the head, or vascular issue like hypertension or stroke. Then we have non-epileptic seizure. Non-epileptic seizure, they have a cause. They're normally as a result of head injury, encephalitis, brain infection, encephalopathy, febrile seizure that normally happens in children. They are all examples of non-epileptic seizure. Now, let me now also go to, for you to understand the kind of seizure happening to these people, I would have to classify seizure into focal or partial seizure and generalized seizure. Focal or partial seizure and generalized seizure. Now, focal seizures happen at a part, of course, majority of seizures, almost all seizures happen in the cortex of the brain, in the cerebral cortex. So, if this seizure happens at a particular area in that cortex of cerebral cortex, and does not generalize and does not spread, it is called focal seizure. If it happens at a particular area and from that place spreads all around the cerebral cortex, it will be called generalized seizure. So now, as I have explained this thing for you, let me now come down to this my patient. Remember what I told you about Apprentice?
Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treater, the Lupus Day.